You must have heard you are what you eat. Do you think I'm going to talk about food? All the mouth watering delicious tidbits and the go between snacks and beverages that we gulp down during office breaks or casual gossips? I wish I could. But it being World Liver Day, April 19th, it's an ideal time to discuss liver health, especially since what goes inside through our mouths directly reaches our liver to be broken into things that ultimately turns into energy or waste. Liver acts as the filter for the whole body. It breaks down the food we eat. It cleanses your blood. It makes bile. It stores energy in the form of sugar. That's what we read in our school biology books, you remember? Let me give you some statistics. Liver is the second largest and the hardest organ in the human body. It performs around 500 vital functions, including detoxification, metabolism, and immunity. Over 100 diseases can affect your liver. 2 million lives are lost each year to liver diseases. 1.5 billion people suffer from chronic liver diseases. Without a healthy liver, toxins accumulate, nutrient absorption falters, and metabolism weakens, impacting our overall health. Hello, I'm Preeti Prakash, and I have with me today one of the most distinguished and leading gastroenterologist surgeon with me, Dr. Sumesh Kayastha, a recipient of Vishisht Seva Medal from the President of India in 2024. His area of expertise are liver transplant, GI oncology, bariatric, and robotic surgery. He has served in the Indian Air Force, having rendered stellar services in the Army Referral and Research, popularly known as the RR Hospital, in liver transplant. So welcome, Dr. Kast.
Thank you, ma'am. Good evening and thank you, ma'am.
Let me begin by asking first a very basic question. How can a liver go wrong in our bodies?
So, good evening. So actually, liver is the extremely vital organ and it has around more than 500 functions. And primarily it is a detox organ. It stores energy and, regulates the body temperature apart from numerous other functions. So another flip side of this is that it's a silent organ as well because, it doesn't cause any pain. It may be slowly, silently dying and the patient will not come to know till it's very late. So it's very important for us to keep the liver healthy, and for that what is really important to have a very good lifestyle, a very the diet and the exercise has to be paramount, in which the diet has to be a very balanced diet. It has to be lean proteins, whole grains. Try to avoid alcohol as much as possible because it's actually liver poison, and avoid eating from outside any sugary stuff, any junk food, and make it a habit that person should be going for exercise on regular basis so that the fat does not accumulate inside the liver. Because nowadays, initially, there are different causes of liver problems like viral hepatitis, alcohol, but nowadays fatty liver is becoming the major concern. And when fatty liver is unregulated and it's high stage, eventually it leads to liver cirrhosis. So these are the basic things of lifestyle changes, and having a very balanced in food intake and a regular exercise is the key to keep your liver healthy.
So, I mean, these are you suggested some ways of how to keep the liver functional, but what, according to you, what can really go wrong with the liver? If we talk of common people, they have a lot of liver problems. I'm sure they keep coming to you also for a lot of things. So some few problems where the liver can acutely go wrong. What liver problems that the liver can have.
Okay, ma'am. So basically, what happens is that liver can get into failure acutely or it may, over a period of time, decline its function and become cirrhotic. So acute liver failure, the most common cause is hepatitis A and paracetamol poisoning or some poisoning like mushroom and all. So these are the factors where the liver is absolutely normal and it stops functioning, or rather the functioning declines so much that the patient may end up getting a liver transplant, requirement of liver transplant, and may even lose life if he doesn't get transplant in time. So one is acute liver failure, and the other one is chronic liver failure, which is the most common cause of liver problem, which happens over the period of few years. And the most common cause is, as I said, alcohol, viral hepatitis, and the symptoms. I believe, how do you come to know when the person thinks that there is something wrong with his liver? Is that there is certain amount of malaise, fatigue, he doesn't feel very energetic, and in a later stage he may find there is yellowish discoloration of eyes. He may be passing urine which is dark colored. There may be belly, the water in the belly. There may be sudden retention of fluid in the body which may cause ascites, or there may be pedal edema, that means swelling in the legs. And later stages, maybe there may be bleeding tendencies, and there are many other things, but these are the basic things like having jaundice, water in the belly, swelling in the legs, general lethargy. So these are the symptoms and signs which actually tells you that the patient may be, or the person may be having advanced liver problem. The initial liver problems are very difficult to catch. As I told you, it's a silent organ. You just don't come to know what's happening inside the body. So a regular checkup is extremely important.
So this was a good point from you. These are the symptoms that one should look for in case of an unhealthy liver.
Yes.
Okay, now you being having a record of the highest number of liver transplant. In what I would want to ask, that in what condition is a liver transplant required actually?
No, no, I have not done the highest number. There are many, many people who have done quite a large number of transplants. But the coming to the question is that what are the reasons for, you are asking what are the indications for getting a liver transplant done?
Yeah.
So there are four stages of liver failure. One, the first two stages, compensated liver failure. That means the patient has cirrhotic liver, but it has not decompensated. That means the patient has almost normal life. There is no water in the belly. There is no vomiting of blood. In stage 3 and 4, the liver has decompensated in the form of either having water in the belly, which is called as ascites, or the patient has vomited blood. There may be hepatic encephalopathy. That means the patient may be, drowsy, or maybe speaking something which is absolutely does not make any relevance. And there may be, the kidney functions may be damaged, hepatorenal syndrome, which we call it as. So these are the things which tells you that the liver has decompensated. That means it's just barely surviving, and at any time this becomes extremely life-threatening. So when the liver starts decompensating, the first episode of decompensation in the form of ascites, vomiting, hepatic encephalopathy, or infection in the abdomen, like which is called as spontaneous bacterial peritonitis, these are the indications that the patient should consider strongly, or the physician who has been managing him should refer these patients for liver transplant, because the earlier they're subjected to liver transplant, the better is the outcome. Other factors which I told you about, poisoning, paracetamol poisoning, or hepatitis A, acute liver failure. So these are other factors which require urgent liver transplant. And these are the indication. Then we have something called as MELD score, which is a model of end stage liver disease. MELD sodium, which takes bilirubin, INR, your creatinine, and the sodium value, and then you calculate. If the normal reading is from 6 to 40, so anything which tells when these parameters are deranged or more than 50, this also becomes an indication for transplant. So bottom line is, when the liver decompensates in the form of ascites or vomiting of blood, or the other things like hepatic encephalopathy, the first episodes itself becomes an indication for liver transplant.
So how much percentage you would say, you would advise that a patient to, look into that, after this percentage of damage to the liver, he should be going ideally for a transplant.
So this is a very, very common question, ma'am, which people ask, how much of my liver is not functioning?
Yeah.
So it's very difficult to say that it's 70%, 90%. But generally, you can say it like, if I have to make it rough, it could be like 90% of your liver is gone. But it's not the right way to, say that how much percentage, because it's end stage liver disease. That means it has reached its finality. It's not going to really improve from there, and it's only going to decline.
So the
So there are
90% is then, but
is
maybe
gone.
60% or say even you would suggest 50%, abhi chalo theek hai, you can
So
hold
that's
on
what
for
I
some
said.
time.
Yeah, that's what I said. If it is in stage 1 or 2 of liver failure, which is compensated liver failure, which has a median survival of 9 years, that means if you don't do transplant, the patient would, on an average, live for 9 years. But if it has decompensated, that means in stage 3 or 4, the median survival is 1.5 years. So decompensation, the first episode itself becomes an indication for liver transplant.
Okay. So for our audience, if you could briefly tell us what is the procedure of the transplant?
Okay, ma'am. That's a very interesting question. And a lot of people want to know who their loved ones may be in need of it. So there are two types of liver transplant. One is called as the cadaveric liver transplant, which is from a brain dead patient. This brain dead means that his brain has stopped functioning because of devastating brain injury in the form of road traffic accident or a massive stroke inside, or there is a bleed inside, that his major cerebral functions have stopped functioning, and his brain stem has also stopped functioning, but his organs are just functioning. They would function for maybe 2 or 3 days. That is the window. If the relatives gives consent for organ transplant, then 8 lives can be saved from that individual who has the person or the loved ones who have given the consent for liver transplant from the deceased donor. So one is deceased donor liver transplant, and another one is living donor liver transplant. Living donor means your near relatives. That means, according to the legal requirement, it should be your near relative, like your kids or your parents or your grandparents or your siblings. So they should be near relatives, and if they are healthy young adults, that means the age between 18 to 50 years, and they are doing well, they don't have any major illness like diabetes and all, they become a candidate for liver donation. So a part of the liver, around 50 60% of the liver, is taken from there, and the liver which has failed, the recipient, that liver is taken out, and this liver, which is around 60 65% of the liver from the donor, is implanted there. It's very simple to say, but it normally takes around 12 hours on an average, this surgery. And matter of fact, we have a transplant tomorrow morning. So it takes around 12 hours. And it's a very complex surgery. So the donor surgery takes around 4 to 6 hours. The recipient surgery takes around 6 to 8 hours. So in this, the chances nowadays, the survival is around 90 to 95% post surgery. It depends upon a lot of factors. And so the next question which the patient and their relatives ask, that what happens to the liver? Will we be living with half the liver? No. It's a very unique organ, liver, which, like your hairs, it also grows. So on an average, in 2 to 3 months, it comes back to almost nearly the same size of what initially was. So if it was 1.5 kg, it reaches almost the same weight in around 2 to 3 years in both the recipient as well as the donor. And the donor actually has a very normal life after that. He does not have any issue whatsoever. And the recipient, obviously, this is a new lease of life. So he continues staying healthy, doing whatever he was doing before he got ill. Except for that, he needs to be a little careful. He has to take immunosuppressants for life.
So is there there's so much progress in technology. So has this also modernized this transplant?
Yes, yes, ma'am.
Since it was maybe how many years?
Yeah, the first successful transplant, was done in 1967 by Tom Starzl. And after that, a lot of things have happened, and the major revolution had come in with the immunosuppressants. So immunosuppressants have really improved. And with time, obviously, the techniques, the surgical techniques, the energy sources, and a lot of things have happened. And in the last, I would say, in last one decade, last decade, the minimally invasive surgery for transplant has also pitched in a big way. A lot of centers are doing, laparoscopic or robotic donor hepatectomy. That means the donor who, especially if they're young women, they undergo, liver resection not by a major incision, but by minimally invasive technique using laparoscope or robot. Yeah, so that's the change.
Great. Now, despite vaccines, for hepatitis B and hepatitis C, it still remains a concern in India. So, who is most at risk, with this kind of a problem?
So, ma'am, hepatitis B and hepatitis C is basically through blood, by blood contact or through STD. So, for healthcare workers, especially, they are at risk, and those who are dealing with blood or those who are getting involved in, uh, you know, uh, kind of where sexually transmitted diseases can happen. So, these are the ways where hepatitis B or hepatitis C can be transmitted, and also vertical spread through mother child. If mother is infected, the child also becomes infected. The good part about hepatitis C is that if it is, diagnosed early, you can have almost 90, more than 95, almost 98% cure rate by having around 2 to 3 months of medicines. So this is a big change. Otherwise, initially, many years back, hepatitis C, there was no cure, and the patient usually used to end up with cirrhosis. And hepatitis B, we have vaccines for hepatitis B and hepatitis A. There is no vaccine for hepatitis C. So the in hepatitis B, it is recommended that if for a young person who is like healthcare worker or who is more prone to get hepatitis B, he should get vaccinated. It is usually at 0, 1 month, and 6 months. 3 doses are given, which gives you lifelong immunity. And the booster dose can be taken after 5 years. And if kids nowadays, for kids who are just born, they are given within 24 hours, then after 1 to 2 months, then after 6 months. So this is how hepatitis B can be prevented. But if it happens, then there are medicines for hepatitis B and hepatitis A to keep the virus dormant, and it should not cause damage to the liver, leading to cirrhosis. So nowadays the medicines have come in a big way. So it just needs to be diagnosed early, and the rest we can take care of it.
Okay. Now, is liver damage reversible as it is generally believed, and there's a word that is always around, the liver damage is reversible for that matter.
Yes, ma'am. So
What do
it
you
dep
say about that?
it actually depends upon the stage. So if it is fatty liver, then obviously it is reversible, and the sole factor which can reverse is by reducing body weight. So that's the best. There are medicines, but I would suggest that by having a good diet and regular exercise can reduce your weight, and that can take care of your fatty liver, even fatty. But if cirrhosis has set in, it's like scarring, then you can halt to some extent the progression, but it becomes very difficult to reverse. So it's like, the scarring has already occurred, the nodules have formed, it's very difficult for it to reverse. So reversal is usually not possible. There is certain amount of reversal, especially in alcoholic liver disease, where the person stops taking alcohol, or it's hepatitis C virus. There is some amount of reversal which is seen, but it is not phenomenal. More or less, you can take it that once the cirrhosis has set in, it's usually irreversible. So the prevention is the best cure.
Okay. Now, as you just said, there's this, the fatty liver is quite a common problem. Uh,
Yes, absolutely,
how do
ma'am.
you
So
suggest a lifestyle change or dietary triggers, um, which can uh, which can be taken care of to prevent this fatty liver? And what is the fatty liver actually? So liver going fat is fatty liver,
yes, ma'am. This
literally.
is,
Yeah.
I think this is something which is a very pertinent point, and a lot of people who are every 1 in 3 people are having fatty liver in India, because mainly we have carbohydrate based diet. So, and especially with a lot of Blinkit and Zomato coming in, we get a lot of junk stuff, a lot of non-maida stuff coming. So it's very, prevalent nowadays, fatty liver. So what happens is like fat which gets deposited in the body, fat also gets deposited in the liver. And this fat actually causes oxidative damage to the cells because it's kind of pro-inflammatory. This fat itself causes is a pro-inflammatory and causes damage to the internal structures of the cell of the hepatocytes, which leads to death of these cells, and then body tries to regenerate these cells. And there are some which is some cells which helps in healing, which is called as stellate cells, which is very specific to liver. This causes collagen deposit and fibrosis, so a lot of scarring starts happening inside the liver. Also there is death and regeneration of the liver cells. So this cycle itself causes sometimes mutation of the hepatocytes, leading to cancers, hepatocellular cancer or HCC, liver cancer. So fat being inflammatory part, it causes accumulation inside the cell, which causes inflammation inside the hepatocytes, leading to all these things which I have told. So that is why it is very important for fat to be outside the liver cells. And the best thing for which I told you is exercise and your dietary modifications.
So fatty liver is when fat accumulates around the liver, which
No,
damages
it
the
is.
cell.
So there are two types. One is microsteatosis. That means small droplets of fat will be inside the cells. And when another one is macrosteatosis, that means a big goblet of fat will be inside the liver cell, that is hepatocyte. This is the big goblet of cell is the one which causes this oxidative and cellular stress to the hepatocyte, causing this damage. So the cell is not able to metabolize these fat cells, and this leads to damage and this cycle of regeneration, death, scarring, eventually leading to liver cirrhosis. So this was initially called as non-alcoholic fatty liver disease, which is now labeled as MASLD, which is metabolic dysfunction associated steatotic liver disease, MASLD. So which includes diabetes itself adds fire to the fuel to the fire, where if the person is diabetic and feels fatty, it's a perfect concoction of having liver damage.
And cirrhosis is, you're saying, when there are scars developed on them.
Exactly, ma'am. Cirrhosis is the end stage of liver failure. It's where the scarring starts happening to the liver.
So you have
It
anything
becomes
like...
very hard. Actually, the liver, if you see, liver is very supple, soft, maroonish. And a cirrhotic liver is nodular, hard, very difficult to press and bend. It becomes fibrotic. It becomes scarred, and the pressure inside. So whatever blood vessels are going through this through the liver, they become under a lot of pressure because there is hardly any space for the blood to flow from through the liver for filtering. So there is back pressure, which leads to increase in pressure in the veins, and this leads to this can lead to massive blood loss through vomiting and may cause exsanguination or even death of the patient.
So we've also heard about, liver cancer. Is there
Yes, ma'am.
anything like this?
Absolutely. So this is hepatocellular cancer or HCC or liver cancer. This is the most common cancer of the liver. There are different kinds of cancer, but the most common primary cancer of the liver is what you are saying is hepatocellular cancer. And the most common reason for that is hepatitis B virus,
Okay.
which causes cirrhosis. And as I told you, there is regeneration, death, and during this time there is some mutation which happens inside the hepatocyte, leads to DNA mutation, leading to HCC formation.
So that will require a transplant.
Yes, so ma'am, again, if we there are some criterias. If the size is within some, there are different. What do you say? There are different criterias like Milan's criteria, UCSF criteria. There are different one where if the size, if it is falling within those criterias, the best treatment for that is liver transplant. Yeah.
Okay, now I'll shift gear a little.
Yes.
When public hospitals are collapsing under a lot of pressure, and in this scenario, private hospitals remain the one place to go for them. But these private hospitals are very unaffordable for most of the people. So, does healthcare in India effectively depend on the ability to pay for a person?
Ma'am, this is such an important question, and most of these conferences on liver and liver transplant usually has this topic, one of the topics which you are addressing. Unfortunately, the public sector or the government setup in India is has not come to at par with what private is doing. The amount of transplant which private is doing, the it's very minuscule amount the government setup is doing. And there are it is because of multiple reasons. And I wish someday, it catches up and people who cannot afford liver transplant are also given a chance where they can have liver transplant. So that is only possible if it is in government hospitals. In private hospital, it's quite an expensive surgery because it requires a lot of resources, a lot of trained manpower, and extremely resource draining. So obviously, it becomes extremely expensive. Having said so, still India is one of the cheapest country to have liver transplant compared to Western world or other side of the east side of the world, because and that's the reason most of the patients in medical tourism from foreign countries come to India because it's very, very affordable. Still, having said so, it is not at all approachable by people who are lower middle class or even, lower than that. Uh, so it's very difficult to cut cost further because I think most of the centers are actually balancing it out or maybe just making in private sector a little more money than the amount of money spent in sustaining that program. But I hope one day our government setup really takes up and does wonders as what private is doing.
But government hospitals are said to be the best as far as faculty is concerned, as far as cheap cost effectiveness is concerned, and isn't it so?
Ma'am, you're exactly. So there are a lot of reasons why it has not picked up in government setup. One is, as I told you, the sheer volume of cases which comes to the government setup, it becomes difficult. Possibly, these are my presumptions. It becomes difficult for the management to focus on one area, and they have to give lot of resource in form of man, infrastructure, equipments to that particular thing. Secondly, it is not very much incentivized. It's, you are working round the clock, you are working uh, tirelessly. Still, there is no financial or any other form of incentive. Second, thirdly, there is a lot of shuffling which happens. It's not, if the team changes or something, there may be, which is very inherent to the government organization, which are the factors which possibly may contribute to not be at par with what private is doing. It's a very debatable topic, very difficult to cover in this. There are a lot of panel discussions have happened on that. Why it's not picked up in government, why it's so much in private, how what we can do. So it's not one stop shop where I can really tell you this is the reason. It's multifactorial.
So
But
how
I just hope one day it just comes up.
Yeah, how much do you think, if you could just tell a rough figure of a transplant or a liver treatment in a private hospital or and in a government hospital, would a person have to pay for a
Okay, ma'am.
treatment?
So let's go first talk about the private. It depends. So if it is a cadaveric transplant, that means a deceased donor transplant where the whole liver is taken. On an average, if I have to keep the figure is around 30 to 35 lakhs. For living donor transplant, it's around 20 to 25 lakhs. So that's kind of a broad outline for the cost estimate for living as well as disease donor transplant. And in the government setup, purely government setup, it would be much lesser. It will be less than for either ways. It's going to be less than 10 lakhs for sure. And if the person is BPL or it's below poverty line, then obviously it's almost free. for the patient this thing. But there are centers like ILBS, which is mainly public-private partnership. It's cheap. It becomes around 14, 15 lakhs of the total cost, much cheaper than what pure private is causing, but still it is significant amount.
So would you suggest anyone coming to you for just advice, would you advise them to go to the government hospital, or would you want them to advise them to come to a private and get it?
Ma'am, wherever they are having a successful transplant program, they can go, because I think as of now, obviously, if I have to see, there are lots and lots of private centers which are doing phenomenal work and massive numbers. So, expertise wise and by sheer volume, I would say the government, the private one is doing better job undoubtedly than the
More
government, because the
professional, so
numbers.
yeah, doing it more professionally because
Yes,
they have resources,
they're
as you
doing
said.
almost on daily basis, and
Yeah.
it has become a very routine surgery for them. The whole team becomes the whole machinery becomes very greased,
Mm.
and everyone knows the protocols very well. So where the volumes are higher, the outcomes are also better. So, uh, uh, but there are centers in government as well. They are doing good jobs. So it's difficult to say, but most of the private centers are doing.
Very well.
Most of the liver transplants.
Okay. So I mean, any patient who goes to a government hospital, there's a lot of waiting also there. In government
Yes, ma'am.
hospitals, you see, people in AIMS and all, patients, how they are treated. I mean, I have got to see many times when I have been there. So there are a lot of loopholes also in the government
Ma'am, the
system.
main issue is about getting in. Waiting usually happens for a disease donor transplant, where you are waiting for the organ.
Okay.
You have to be lucky that your blood group, there is a patient who is brain dead, and he happens to be the same blood group, and you happen to be in the first waiting list, so that you get the organ. So all this permutation combination and the demand supply is, so there is huge mismatch between demand and supply.
Mm.
So the wait list, and many patients actually in waiting, don't make it
Mm.
uh, to the transplant. So this demand supply ratio, which is so much of mismatch, that is the reason that most of the government setup, which is mainly disease donor based programs, don't have so frequent transplants happening.
Plus, also the machinery, I think the machinery required. I have seen myself in hospitals, government hospitals, they don't have required equipments for an operation or a.
Ma'am, that I would differ, because I think there is no dearth of good machinery and all in all reputed government hospital. Every hospital nowadays have state-of-the-art machinery.
No,
It
what
is
about rural?
base.
Rural
Yeah, if
areas,
you're talking, ma'am, these
yeah.
high-end surgery is difficult to do in rural areas. It has to be in center of excellence like AIMS, PGI Chandigarh, SGPGI Lucknow, Jipmar, and these are the center of excellence where we can first see it, doing well. Because such a complex requires so much of teamwork, so much of resources, that it's difficult to do the surgery in rural hospitals.
Mm.
So we have to have these successful models first in these center of excellence. Then we can think of eventually, in smaller hospitals, government hospitals.
Okay. So now, finally, my last question to you is your quick advice again for keeping your liver healthy to our audience.
Yes, ma'am. So my take-home message is, there are a lot of myths about, keeping the liver healthy, of, having green tea, detox tea, the best detox, because liver itself is a detoxifying organ. It itself detoxifies any toxins. So one has to have healthy meals, which I told you, colorful vegetables, lean protein, which means less of carbs, less of fat, whole grains, and a lot of fruits. Avoid sugary stuff. Avoid processed food. Avoid getting meals from outside, especially the Chinese noodles, maida, naan, all those things. And make it a habit that one should go for exercise for at least 30 minutes a day. This will make sure that your liver remains healthy, and obviously avoid things which causes damage to the liver, which means alcohol. So one has to, as far as possible, avoid taking alcohol. And even if he's taking it, should be in moderation, because whatever amount you take, it causes damage to the liver. It is, we are, really thankful to nature that liver has this ability to regenerate itself. So despite having a lot of poison and causing damage to the liver by taking alcohol, the liver is able to regenerate. But if you cross that limit, then obviously it just gives up. So keeping these clean habits, good diet, and regular exercise will make sure that your liver remains healthy.
And this you suggest from which age should a person start actually strictly following this, because as children, generally it's children who are having all this
Yes,
junk
yes.
food and all. So is it from childhood or you reach an age
Ma'am,
of
better,
30,
earlier the
35?
better. Earlier the better, but I would say after 40, one has to be very, very careful of what he's eating. But earlier the better. If the person can start having at 25, nothing like it. But at 41, that the bell should ring that now stop it. That's the time when the body, but you can have that liberty of, abusing your body till 40 at least. But after 40, you got to take care of your body. Otherwise, you will have to face the music.
Mhm. Okay. So now my big takeaway from Dr. Kesta's talk is keep your liver fit and kicking. So there are some tips he's given for it. Maintain a balanced and nutritious diet to prevent fatty liver. Engage in regular physical activity to support metabolic health. Limit alcohol consumption and avoid smoking. And get
Yes.
regular liver function tests and
That's very,
vaccination
very
for.
important. That's very, very important, ma'am. After 40, I would suggest that yearly one should get his liver function test done, ultrasound done. It's better to get your ultrasound, if not yearly, too early at least, to look for how the liver and the other organs are. But one should get his liver function, his renal functions, his basic CBC, ECG. These are annual tests which one needs to be doing after 40. That is universal for every. It will take care of not only liver, your entire organ, entire body, how is it functioning, and any small sign, anything which is developing, you'll come to know and you can take care of it early.
Okay. Okay. And regular vaccinations for hepatitis
Absolutely,
A and
absolutely.
B, right?
Yes.
So to my audience, remember 90% of liver diseases are preventable. Thank you so much, Dr. Kaista, for being with me and talking to me and giving so much information about liver functioning to our audience. Thank you so much.
It was pleasure, ma'am. Thank you so much.